HIV/AIDS awareness, educating the public to end the stigma.
We ask so you may know.
We feature so you may appreciate.
We inform so you may decide.
We balance so you may judge.
CBRC Gumaka offers programs for lead and civil service, located at with this contact number. Enroll now.
There's still a surge of HIV-related cases in the Philippines and all over the world. The Philippine statistics alone hit its highest level last May 2017 since records began back in 1984. In commemoration of the World AIDS Day, everyone is encouraged to help end the stigma and support the government in preventing the said disease. So what are the things that we need to know about AIDS and its implications? Let's hear more about the said disease from our correspondents Pia Garais and Virgo Lopez.
What is the difference of HIV and AIDS?
The human immunodeficiency virus, or HIV, is a virus that destroys a type of white blood cell in the immune system called a T helper cell, makes copies of itself inside these cells, then leads to gradually deteriorating the body's immune system. Acquired immune deficiency syndrome, or AIDS, however, refers to a set of symptoms and illnesses that occur at the very final stage of HIV infection. HIV and AIDS can be transmitted through direct contact with the fluid emissions of another human, example, through blood contact and sexual intercourse.
I'm worried about getting HIV and AIDS. How would I know if I have it?
It is normal to worry, especially for people who are sexually active and who have different sexual partners. But testing is the only way to know for sure if you have HIV. Virgo, did you also know that the usual reasons why people don't get tested for HIV is because they are scared of HIV? They are scared of the tests and the implications of the results, especially if they turn out to be HIV positive, and of course, what other people will think.
I am also worried about what will happen if the results turn out to be positive. What should I do?
A lot of people worry about their HIV test results, like what it would mean for their lives if they are tested positive and what people would think of them. Sometimes, just the thought of going to a clinic scares some people because they think they might be judged. It's perfectly normal to worry about these things, but remember, HIV is treatable. Once you are tested positive, you can start with your HIV medication called antiretroviral therapy, or ART. By adhering to your treatment and staying as healthy as possible, you can keep the virus under control and you prevent the HIV infection from progressing to AIDS.
What is the government doing about this to protect us citizens against the epidemic disease?
According to the Department of Health, a total of 2,276 Filipino youth between 15 and 24 years old were found positive for the human immunodeficiency virus, or HIV, alone from January to August 2017. In line with this, a total of 4,388 new HIV cases, including 516 AIDS cases, and 187 deaths were reported by the DOH last year. The government is already providing policies and programs to prevent the spread of HIV and deliver treatment, care, and support services to Filipinos living with HIV in accordance with evidence-based strategies and approaches that follow the principles of human rights, gender equality, and meaningful participation of communities affected by the epidemic.
Thank you, Virgo and Pia. Though there are still no known cures for HIV and AIDS, medical practitioners have to stand hand in hand with the government in educating the Filipinos about the disease to raise awareness and to finally end the stigma. We ask so you may know. We feature so you may appreciate. We inform so you may decide. We balance so you may judge. I'm Joyce Renata and this is CBRC News Live. Good day.